Oh, Giovanna, just so you know, you're going to need to take notes today. You are going to have, you ask the ones that was here yesterday. Get some paper today. And I'm sure you need a pen too, right? All right, y'all start bringing y'all supplies to school. I don't even know if I have it here. Here's one. These my good pens. I want them back. Please, please. All right. Nail structures, disorders, and diseases. Why do you need to know this information, y'all? We nail techs, right? Do you want your, I don't know, OBGYN not being well versed on the, the girl parts? Would you prefer that he knows more about the boy parts or she? Yeah, I think I want him to be well versed on this information. So you should know this information as well as a well-rounded nail technician. You guys will be probably not so surprised. Very, very surprised at how many nail technicians can't even tell you what the matrix is or where the cuticle is. Do you guys see this stuff all the time, right? They're cutting stuff, they're calling it the cuticle, and those of you that have already done this lesson, you know where the cuticle is, hopefully, right? And the difference between the eponychium and the proximal nail fold, and we're going to talk about those things today because they are very, very important, okay? Now, we're going to also talk about diseases, all right? Things that you guys should know to be able to recognize. Now, remember that in our industry, we as nail technicians, we don't diagnose. All we do is recognize and refer to physicians, okay? We do not diagnose disorders and diseases. However, you need to be able to recognize what they are so that you can tell your client, sorry, I can't work on you today. You need to see a physician before I can do your nails. And, I know you see a lot of nail technicians, especially on TikTok, doing a lot of things that they should not be doing. Y'all send me videos constantly. Miss Mary, look at this. Look at this girl, what she's doing. And it is embarrassing to our industry. So I don't want you guys to be that one because, sometimes I do comment and then they block me. They see School of Nails and then they block me, But anyhow, all of this information is going to be on your state board as well. So it's very important that you know these things. You may not ever use the word eponychium again in your career. However, you will see it on state board, okay? Now, we're also going to label the structure of the nail. We're going to point out all of these different parts, and I cannot reiterate this enough. Please take notes today because there will be a test after the end of this discussion, okay? So, and I mean detailed notes. I said that yesterday, and when it came down to the actual diagram test, we didn't do so hot. Most people didn't pass it, okay? So I want you guys I'm going to reiterate it today so that way I know you guys take mental notes or physical notes of this picture that you're about to see. Now, we'll also talk about what affects nail growth, okay? And there's no special serum or special thing you can do to make your nails grow, okay? And we'll talk about that as well. As well as unhealthy conditions of the nail and what is within your scope of practice. What's scope of practice, y'all? What you are, not just what you're allowed to do, but legally allowed to do too, right? Because, there's no nail police that's going to come arrest you for doing something like a Russian manicure, right? However, when it comes down to going to court or, things of that nature, they are going to ask you, hey, what are you legally allowed to do in your industry? We got people doing BBLs in hotel rooms. People go and get it done all the time, right? Is that legal? You see these people going to jail. I'm not saying you're going to go to jail, but you may want to after they take your house, your car, your kids, your husband, everything, because they sued you for everything you got. Okay, it's not worth it. There's nothing on this here internet, no nail look or procedure that's worth you losing everything that you worked hard for here in this school, especially what you paid good money for, right? So, and the education that you worked hard for. So, let's jump right into it. So, as a nail technician, why you need to learn this stuff? First of all, we are supposed to be expertly grooming and beautifying nails, okay? That is what we do. We are not doctors. We are not nurses. You might be in your other career. However, when it comes to nails, your only job is to expertly groom and beautify people's nails, okay? Now, we can offer guidance to our clients, okay? Meaning, if your client has dry cuticles or crusty skin around their nail plates, okay? We'll talk about those particular terms very soon. But you can guide them and say, hey, your nails are looking a little dry. The skin around the cuticle area is getting really. Why don't you use this cuticle oil, okay? How many of y'all remember or heard about my my little, what would we call it? Encounter with some famous nail techs about their miracle cuticle oil on the internet. Anybody? Y'all ain't been with me that long? Oh, okay. Well, there was this particular company, I guess or nail company, well, that was promoting a miracle cuticle oil, saying it cured cancer and everything, just about. And yeah, we had a whole TikTok thing. It was like we went live together. We were going back and forth and all kinds of stuff. Yeah, it was recorded and put on all on the internet. Yep. But with that being said, I'll give y'all more details on that one. I'm not live. But with that being said, we can guide our clients on things they can do. For instance, if a client has dry, brittle nails, we know as nail technicians what a client may want to do to help that. Because maybe they're dehydrated. We can't diagnose that, but we can tell our clients, your nails are really, really dry and brittle. You may want to try and drink more water. Stop drinking Starbucks all day long. Drink a little water every now and then, okay? Now, we also need to know the difference between the cuticle and the eponychium, okay? That's a big word. And hard to say and spell, right? I don't even think I ever spell it right. But what is the difference between those two things? They are two very distinct, different things, okay? And when we talk about those two different things, that's when we're talking about the Russian manicures and the controversy behind that. And we'll get into that detail as well. All right. Now, this lesson is going to prepare you to move forward into more advanced services, okay, and advanced techniques. Any of you guys interested in becoming an advanced nail technician, or do you even know what that is? Anybody? Nobody wants to be an A&T? I say, huh? Yes. So the advanced pedicurist or advanced nail technician, I don't know why. I really hate the name, to be honest, because it doesn't really explain what it is. It makes you think, oh, I'm going to be doing advanced nails, like, when we talk about nails. But toenails are nails, But the lady who created it, she called it the advanced nail technician course. And it is advanced pedicuring. And this is when you start getting into medical pedicuring, okay? And that's when you're also going to be able to charge people big bucks for doing simple stuff like clipping their extra thick toenails under the care of a physician, okay? And you can also charge these clients through insurance, Medicare, Medicaid, whatever insurance company they use. So that is, you definitely need to know this information before you can go into that realm of things. All right. Now, let's define the natural nail unit. Now, I'm not going to tell you to do what Doug Schoon tells his students to do, which is take this picture that you're about to see, print it out, and put it in front of your toilet so you can memorize it. That's a little extreme. However, I am going to tell you that this is a very important diagram that you should know every single part, okay, for purposes of being a well-rounded nail technician, also for purposes of passing this test at the end of this class, okay, and state board. So, number one, what is the natural nail unit, y'all? Where does it start and where does it end? When we talk about the natural nail unit, what are we talking about? Which part of the finger? From where to where? From, absolutely. Somebody watch, this is the theory. I'm so happy to hear that. From the knuckle, the very first knuckle to the tip of the finger is the natural nail unit. Of course, you know, we deal with the hands in general, especially when we're doing manicures and we work from the elbow down. But when we're talking about the natural nail unit, it's composed of several parts. But those parts we're going to talk about are from the first knuckle to the tip of the finger, okay? And those parts are going to be, and we'll talk about them in detail, each one of these: the nail bed, the matrix, the nail plate, the eponychium, on and on, okay? Now, what is the nail technically supposed to be called, medical wise? What is the name of it? It's right there on the screen. The onyx. The onyx. Y'all gonna talk to me. I swear TikTok it's 15 people in here. Not really. How many? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 people. 11, 12. And I want y'all to talk to me, okay? The onyx. We've heard that word before in to describe other things, right? What else? What would that be? What else? What is the onyx? When you hear that word, what else do you think about? Isn't there like a birthstone or something? Maybe not a birthstone, but a stone called onyx. Isn't it like a black stone, right? What I get from that is stone, a stone, something that's hard, okay? So the nail itself is hard, and it's composed of several different proteins, but the main one is keratin. Where else do we hear about keratin? Hair. Where else? Yep, skin. That's right. So hair, skin, and nails. Y'all, any of y'all take that vitamin every day? I take that every day. Hair, skin, and nails vitamin. I still got to wear a weave. Hair, skin, and nails are composed of keratin. What about keratin treatments? Y'all seen those before or ever been in a salon when they're doing them? Don't it stink? Ooh, it stinks. But keratin is what it's composed of. Now, how do you recognize a healthy nail? What does it look like? What are the attributes of it? Pinkish color. I don't care what race you are. If your nail bed is black, like the color of y'all scrubs that y'all should be wearing, it's probably not healthy, right? Or if it's green, okay, it's probably something going on there, right? So a pinkish, firm, how about flexibility? Is it going to, if it bends a little bit, just a little bit, but doesn't break, is that good or bad? We want to have a little flexibility, right? We don't want it to be brittle and just crack and fall apart, all right? So it's going to be firm and flexible. It's going to have a little shine to it. We don't want them to be dry and dusty looking, okay, because that might be some type of disorder going on there. It's going to be slightly pink in color, and the surface should be smooth and unspotted. You see what I'm doing here? Okay. So, with no splits or grooves in it, okay? Now, it doesn't necessarily mean if you see a spot here that the nail is like, oh, don't touch it, you know. But generally, a healthy nail is going to look this way, okay? Now, let's get to the nitty gritty. Let's talk about the structure of the nail. This is a very, very important diagram that you're going to want to memorize, okay? It's right here, okay? All of these parts, you're going to have to label them today. And you need to know where these parts are and the function of each and every one of them, okay? Now, the first ones we're going to talk about. Now, this is what we call a cross-section of the nail. Cross-section. I don't have a top view picture, so I'm going to use my actual finger instead for the top view to show you guys these different folds, all right? Now, the proximal nail folds. You guys have heard me use this phrase before. I'm sure you're probably like, what is she talking about? Because y'all hadn't really had this chapter yet. But The proximal nail folds, they are the skin, or excuse me, the nail. We're going to just talk about the nail folds in general because there's more than just the proximal nail folds, all right? The nail folds in general are this skin that goes around your finger, all right? So let me zoom in on my finger here so you guys can see what I'm talking about, okay? Ooh, my skin is dry. All right, so when you look at my finger, okay, you've got this skin around the finger here. And it's a U shape, like a horseshoe shape, right? Well, we've got two different folds that you need to know about. Number one, the proximal nail fold. You hear about this fold all the time. This is the proximal nail fold. It is the area of the nail that a lot of people call the cuticle area, okay? That's this U shape here. Now, these folds on the side are called the lateral nail folds. Lateral nail folds. What does lateral mean? Up and down. Up and yeah, they're going to be beside each other. Like, think about the word parallel, right? The word parallel has two L's in it, and they are right beside each other, okay? So that'll help you remember the lateral nail folds and then the proximal nail folds all together makes up the nail folds of your nail, okay? So you just be able to recognize those two different ones. Now, why do we call it a fold? Why is it called a fold? If you look at this picture, you can see, because just look at the pink skin, okay? We're gonna assume this is a white lady, okay? The pink skin there, it wraps around from you see where it says stratum corneum there? It starts there, which is, what is the stratum corneum, y'all? Does anybody know what that is? When we're talking about the stratum corneum, what is that? It's just another name for the skin on your finger, okay? The stratum corneum, and because if you look at the skin on your finger, look really, really close. If you look at it, it kind of looks like, oh, damn. It kind of looks like little pieces of corn cobs, right? It looks like a corn cob, yeah? It's little squares and little lines, and mine look dry and old, okay? But the stratum corneum, if you magnify it, kind of looks like corn, okay? So that'll help you remember that particular word means the skin on your finger. But if you look at it, that pink line, it starts on top of the nail and it folds. Doesn't it look? Think about when you fold a towel, how it folds. You have that little bend in it, right? Well, it folds under because if we lift that flap up, that fold up, there's still skin under there, okay? So that's why we call it the folds, because it quite literally folds underneath and creates like a flap on top of the nail, all right? Now, that entire flap of skin covers what's known as the matrix, okay? And it extends from the edge of the visible nail plate, meaning that cuticle area, the free edge, to the first joint of the finger, all right? To the very first joint of the finger. So you see how it flaps over from the matrix to the edge of the cuticle area to the first joint of the finger, meaning that stratum corneum. You can see that V-shaped pink line that wraps all the way around. Now, this tissue folds back underneath itself to create that flap, and it has a purpose. What is the purpose of that area? What is the purpose of the cuticle? Anybody know? Like, what is it even for?
It protects the matrix.
Absolutely. It protects and shields a very sensitive area of your nail known as the matrix. We'll get to that matrix and why it's so important to be protected in a second. But it has a purpose. We actually disrupt the purpose of the cuticle area in that proximal nail fold when we do our job. That's why we have to do it cleanly, okay, with disinfected implements, and in a way that we don't injure our client and open them up to infection. This is why, like I said, what we do is really kind of defeating the purpose of what the cuticle is for. But again, we have to do it the right way. This is why you're trained the way you are here, okay? Everybody understand where the folds are and what they're called, how to recognize them. So the two on the side are your lateral. You got two of them, hopefully. And then you got your proximal nail fold, which is that U shape down at the bottom of the nail, known as the cuticle area. What does proximal mean? Somebody said it. Huh? Close, yes. Close to you, closer to proximity. What is your, when I say, I might be a real nerd if I text you and say, what is your proximity? I'm gonna start saying that to y'all in the morning when y'all gonna be late. What is your proximity, Giovanna? And she sends a picture of her at the train tracks. I was like, which train track is that? What is your proximity? That I'm asking you, how close are you to us? What is the opposite of proximal? Anybody remember from medical terminology? If you ever took any of that in school? Anybody know? The word is actually on that screen there, but it's on another particular part of the nail. What is the opposite of proximal? Distal, right? So in medical terms, we say proximal and distal, okay? Proximal and distal. So distal literally means something that's far away. The distance, okay? The furthest part away from the body, okay? So if you notice, what is the part of the nail that says distal in it, and what is that? The finger bone, aka the distal phalanx, okay? Our finger bones are known as the phalanges, okay? And your distal phalanx is the phalange, the part of the bone that is furthest away from your body. So that's just the technical term for the finger bone, the very tip of it, the distal phalanx, okay? Everybody got that? All right. So the next part of the nail that we're going to discuss is the nail plates. The nail plates, all right? What is the nail plate? Where is it, and what is the purpose of it?
It's on top of the nail bed.
Okay, so it is the most visible and functional part of your nail. What do we even need nails for, y'all? What is the purpose of it? Like, why do we have them? Because we just got stiletto nails and we doing all this extra stuff to our fingernails, but our natural nails, what do we even need them for? You know, God don't make no mistakes. What did he give us those nails for? Imagine how it would feel if you didn't have none at all. They assist us with doing a lot of things, don't they? I mean, I don't even know. I can't scratch my butt. I can't pick my nose. I can't do nothing without fingernails, right? So they have a purpose. They're the most functional part and the most visible part of our natural nail. Now, does the nail plate have any feeling in it? Like if we e-file on your natural nail, do you feel that? Like, do you feel pain when let me give it to you a little bit differently. If I clip your nail, do you feel it? Is there pain there? No. Because if I say if you e-file on the natural nail, you might feel a little pain if they go a little too deep, right? But that's because of a different reason. So there's no nerves and endings or anything like blood vessels or anything in our nail plates, okay? So our nail plate is made of hardened keratin, and it sits on top of that nail bed. And it's formed by cells that come from where? Say it loud, say it proud. Arumi from Statesboro. The matrix. Those cells that our nail plate is made of comes from the matrix. So what can you infer if a client's nail is damaged and doesn't grow right? What do you think that you have damage to? The matrix, absolutely. So your nail, the way it looks, the way it's shaped, the way it grows is directly related to the matrix, okay? Now, your nail plate is made of several layers. Now, notice on there, it says 50 layers or less, okay? So it's normal to have less, not a whole lot less, but you may have clients that have what you would consider thin nails. So you can infer that they probably have less than 50 layers of nails. Anybody ever looked at their nail and like the tip of it is peeling? So when you, and then you want to peel it, don't you? You peel it back, you peel it off, don't you? You got to, you kind of really got to, right? Because it's like hanging off and catching on stuff. How many layers do you think you're pulling off when you just pull off that little peel right there? 1, 2. It's probably 10, 12, right? So peeling nails is not a good thing. We don't want our nails to peel. We want them to the layers to be maintained. So this is why I say when you guys are prepping the nails, please be very gentle with a buffer. You just want to remove the shine. We don't want to be removing layers and layers and layers of nails, because every time you file on that client's natural nail, you are removing layers of their nail. And we need those, okay? So as the nail grows from the matrix, it's sliding up that nail bed, okay? Sliding up that nail bed and growing out towards the, what we call the free edge. We know, as professional nail techs, we want to call it what it is, okay? It's not the tip. It's the free edge, all right? And the free edge, why do we call it the free edge? It's no longer attached to the nail bed. It is free, and it is the edge, okay? Now, our nails are what we call porous. What does porous mean? It's very absorbent. Yes, it will absorb in. Your nail tech knows. If you smoke cigarettes, you can smell it on a client. You can, when you're filing their nails, you can smell everything. If a client it's been absorbed into their nails, okay? Now, that means that water absorbs into the nails as well. The nail has a very absorbent property, which basically means that our healthy nails are going to have a certain water content, which is about 15 to 25%. Okay, so if your nails are brittle and dry, then that means you don't have a lot of water in, or maybe you're even a dehydrated person. Okay, you're not taking in enough water. Okay, so water content affects the flexibility of the nails. So consider this, like think about when you're in a pool for a long time, or maybe in the bath, you take a long bath. What happens to your nails? They get super flexible, don't they? They get bendy and all that stuff. And then once they dry, they come back to their normal flexibility. All right. So when we're doing manicures on clients, this is something you want to consider when you're doing, let's just say, a gel manicure. If you let your client sit in that water for a long time, that nail is going to absorb a lot of water, isn't it? So then when you go to put gel on top of that client, you're sealing that water in. Y'all, I have seen 10-finger greenies on clients that have just got a gel manicure because the nail was way too moist I hate that word, moist to put the gel on, and then it ended up getting trapped underneath the gel and turned the nail green, okay?
A sponge.
Yeah, it's very much like a sponge. Very, very much like a sponge, okay? So I prefer to do gel manicures the dry way, all right? Because you can do dry manicures, y'all, but we'll get to that another day. Now, the next part of the nail bed, okay? What is the nail bed? Because we can kind of say that the nail plate, let's just call the nail bed like your mattress, right? Your mattress, all right? And on top of your mattress, hopefully, if you not a dirty girl, you got a top sheet on it, right? And then you got, your fitted sheet, and you got your top sheet, then you got your comforter or whatever else, a bunch of pillows like me. You got all that stuff on top of the nail. So the nail bed is like your mattress on your bed. It's soft, right? It also, if you get down to the nail bed, if you have filed down so much of the nail plate, that you're down to the nail bed, what do you think, how do you think you're going to feel? What do you think your client's going to feel? A lot of pain, absolutely, especially if you're filing on the, and you don't have any foundation to place your acrylic nails, gel nails, whatever you're doing on your client. So what is the function of the nail bed? First of all, it's living skin. Our nail plate is not alive, right? We've already determined that. There's no nerves and blood vessels there. But our nail bed is quite the opposite. It is living skin, and it supports the nail plate as it grows out towards the free edge. All right. And it has a lot of blood vessels, a lot of blood vessels. That's what gives it that pink appearance. And that area that extends from the lanula to the area just above the free edge of the nail is part of the nail plate. So what is the lanula? What am I even talking about when I'm talking about the lanula? Because that's not on our sheet here.
It's like a white curve.
That little white curve. Yeah, that little white curve. Let me draw something right here. So our nail, the lanula is that moon shape, that little white curve right there is the lanula, okay? So you can see that on the nail bed, all right? Now, like I said, it contains lots and lots of nerves. Now, we talked about with the nail plate that it grows up the nail bed. Well, how is it able to grow up the nail bed without us feeling any pain? How is that possible? Like, think about, if I have friction, right? Because your nail bed is growing, and it's rubbing up against that nail plate, the nail bed as it grows. There's a very thin layer. Maybe my seniors can tell me, maybe they can't.
It's the thing between.
It's that thing between.
Between the nail bed and nail plate.
What's it called? Do you remember?
Eponychium?
Yep, not eponychium. What?
Epithelium.
Epithelium. Absolutely right. So what she's talking about is the bed epithelium. I want you to imagine that on your nail plate, because it's very thin and you can barely see it, okay? On your nail plate, underneath your nail plate, excuse me. Okay, so this is the nail plate, the matrix, my fingertip here, okay? All right. I want you to imagine, so here's my nail plate, and then here is my nail bed underneath. Imagine this like tiny little wheels. It's a very thin layer, like right in between, greasy wheels that help that nail plate just kind of very easily roll up that nail bed as it grows, okay? Like a conveyor belt. Yep, there you go, okay? So that is, bless you, that is known as the bed epithelium. Okay, bed epithelium. Got that? This is how you spell it, because baby, bed epithelium. Not to be confused with the eponychium, okay? We'll get to that in a minute. Okay? Everybody know what, so now we talked about the nail bed, the nail folds, the nail plate. Everybody know where they're at? Excellent. Okay. Next. The matrix. What is the matrix? This is the area where the nail plate cells are formed. We discussed that already, right? This is where everything is formed, okay? It's kind of like like a womb. It's like where the baby is formed. Starts out as a little, and we know about that over here. We got us a little pregnant one. That's where all the cells are formed, okay? And then they grow into the nail plate, all right? And we can get into a whole lot of detail about this. I don't want to confuse y'all, but there's a lot of studies about stem cells and all that stuff, how they turn into the nail plate. Very, very interesting article I pulled up about that. I guess I'll talk about that in a more advanced class. But the matrix extends from underneath the nail fold at the base of the nail plate, okay? It starts, if you notice, if you look on there, let me move my head, Lord. Okay. So the matrix is underneath the nail fold. And remember, we're talking about from the knuckle to the tip of the nail. The matrix is underneath that nail fold, and it extends all the way out to where you actually can see the nail plate, okay? Now, Tasha, you mentioned the lanula, right? The lanula, just for your information, is the visible part of the matrix. You can actually see your matrix, and it is the lanula. That moon-shaped thing you see, the matrix extends out past where you can actually see it. Okay? So some of us have little lanulas. Some of us have big lanulas. Some you can't even hardly see. Okay? But just remember what I said about your matrix, your nails, the shape of them, the width of them, the how thick they, all of that is directly related to your matrix. Okay? How they grow is directly related to your matrix. So think about this really quickly then. If your matrix is so important and damaging it can cause your nails to grow funny or not even grow at all, why on earth are we digging down up under there with e-file bits and cutting the skin to remove it all off of the nail to expose the matrix? Because there are disorders out there that are going to cause your matrix to be damaged. So someone explain to me why Russian manicures are a thing. I don't even really understand. And again, not to mention, I know, we live in the USA. We don't live in Russia. And what they do in Russia, baby, please believe, there's a lot of things that they do in Russia that we are not allowed to do here. Okay? And Russian manicures is one of them. Okay? So the matrix is very, very important. And if it's damaged, no nail for you, honey. All right? So that whitish moon shape, again, is an extension of the matrix. And they're not always visible. Okay? So we don't want to mess around with that matrix. Okay? Now, that growth plate, the nail plate growth, like I said, is directly related to your matrix. And the way your nails grow, your health directly affects that. Okay, so don't believe these people that are sitting on the internet and they're about 500 pounds talking about healthy nails, baby. We're not gonna take no advice from you. Okay, healthy nails come from healthy people. Okay, you can sometimes look right at someone's fingernails and tell that they have something going on. When I told y'all I was a medic, I don't know if y'all knew this. I was a medic for years and worked on an ambulance and in the hospital right over here across the street for years. One of the things as an EMT that we would do when our clients first, when we first presented with our patient on the scene is, it was something that you probably never even, if anybody ever called an ambulance, you probably never even realized what they were doing. They grab you by your wrist and say, "How you doing?" Mm-hmm. And they're checking your pulse, right? And then they'll take your finger and they'll pinch it, and they're looking for what we call capillary refill. What does that mean? Absolutely. Somebody knows a little medical stuff, don't you? A little bit. Capillary refill is when I pinch your finger, I want to see how fast, because if you pinch your finger, it turns white. We call that blanching. All right? And how fast does it take for that blood to fill back up and turn back pink again? Well, if you have maybe low blood circulation, poor blood circulation, or as the old folks call low blood, right? Maybe you're diabetic and your blood is just not reaching your extremities, your limbs very fast. You can almost tell that by just touching somebody's fingernails, okay? So your health is very, very, very much directly related to your nail growth, okay? If there's a nail disorder or disease present, you may have some type of issues with nail growth and also an injury. So that brings me to my little ugly fingernail. Okay, I'm gonna show y'all my fingernail. So, and I have a gel manicure on right now. Okay, just a regular schmegula gel manicure. Anything y'all notice about my fingernail? How about it? Let me give y'all a comparison.
Mine has like a hump. One side is rounded and the other side has like a little dent in it.
Okay. What do you notice about my sidewalls on that left finger?
It curves.
Is my sidewall, is it down inside the nail here, or is it just free compared to this one? Like this right here, I've got what's known as the nail groove. I've got a groove there, and it's like a ditch. Whereas here, it ain't none. It's just free. It's free and open. So let me explain why it's like that. Okay, you've noticed there that my finger has a funky shape to it. Okay, so here, let me explain what happened first. Okay, when I was a little kid, my mama ran a daycare. She was when I was little, she was the director of a daycare. Okay, and so that meant that every day after school, I had to go with my mama and wait for y'all late folks that pick your kids up late from the daycare. Y'all know, look at Fabby. She like, that's me. I pick them up late every day. And I had to wait with my mama, and then she had to close the daycare, put all the money in the bag and go take it to the bank and all that stuff, right? So I was always that little rambunctious kid, and then of course there was other kids there. So we're playing hide and go seek. Now mind you, this is a daycare, so they got these big industrial commercial doors, like the ones we got on the school right there. You know what I'm talking about? The big doors. Okay, so I'm hiding behind the door because I was a big fat kid now. I'm hiding behind the door, and I'm waiting for the kid to come in to find me, and she opens the door, and my finger happened to be in the crack of the door right here. Just as she opened it, and crunch. I don't remember much because I passed out, but I do remember my mama taking me to the ER, and this is what ended up happening. So my finger grows this. I have no sidewall, y'all. Absolutely. If this finger was not covered with gel polish, it would look like I have a free edge on the side of this nail. Okay, like a white free edge. If you notice, there's a scar here. You see it? Right here. Okay. And then there's one here. Okay. If I flip my finger around, you can see that my finger was hanging by this piece of flesh right here. Okay. In other words, I cut the tip of my finger off completely. It was just dangling. That's why I was passed out completely. Blood everywhere. Okay. You can see the bone. It was exposed, all of that. Now, the only reason so remember I said the nail growth is directly affected to your health, a disease, disorder, or damage to the matrix. So the only reason I have a fingernail that grows at all is because my fingernail, when you look at it, my lanula is intact, okay? However, it got clipped right there. It got clipped. So my sidewall, remember the lanula is an extension of the matrix. So my sidewall grows funny. Had I been cut even just a millimeter lower, I wouldn't have a nail that grows at all on this side of my nail, at all. It wouldn't grow at all, okay? It would grow on this side that wasn't damaged, but over here, it wouldn't grow at all. So I'm very fortunate that I even have a nail, okay? So messing around with the matrix can cause your client's nails not to grow at all. Now, that was a severe injury, okay? But like I said, digging down, pushing the cuticles way too far back, digging down in there, and you damage that matrix, you might be the reason why your client don't come to get their nails done no more. Okay? Now, everybody understand that, what the matrix is, where it is, why it's so important? Okay, so let's move to the cuticle, all right? This is a very controversial subject, okay? And if you are a well-versed nail tech, then you can argue with on the internet with confidence, like I do. I stay out of them these days because I get blocked all the time. But what is the actual cuticle? What is it?
The dry skin on your nail plate.
That dry, crusty skin on your nail plate. Okay, so with that being said, it's colorless, right? Before we push it, it's colorless, right? But then we push it and it turns white and crusty. Okay. Now, is it living or non-living? Non-living. How do we know that? Because we can cut it, we can push it back and there's no pain. It's not, if we mess with it, it's not going to cause you to flinch or anything, right? You're not going to bleed. All right. Now, where does it come from? Why is it that it keeps reappearing? I done removed you every 2 weeks for my entire life. Why do you keep coming back? Ooh, crickets.
The dead cells from the.
Yeah, because you know the answer to this. Yes. But why does it keep coming back? All right, so let me explain why it keeps coming back. Okay, first of all, it's pretty strongly adhered to that nail plate, isn't it? If you don't move it or shift it, it doesn't really go anywhere, okay? So it's strongly adhered to the nail plate, and we determined that the cuticle has a purpose, right? What's the purpose? To protect the matrix at all costs, right? It's that seal between the PNF, the proximal nail fold, PNF, and the nail plate, all right? So over time, if you don't mess with it, it will sometimes pull away from the nail plate and cause what we call hang nails, right? Those annoying little things. Sometimes they rip back and it feels like your whole life is being snatched out, right? So that hang nail, when it hurts, it's because it's still attached to something living, all right? So there's a difference between the dead cuticle and what is known as the eponychium, okay? Now, before we move to what the eponychium is, before we move to that, let's talk about these nail products, okay? Nail products that kind of confuse you guys. And it not only confuses you, it confuses the consumer, okay? It confuses the client. For instance, what is a cuticle moisturizer? Why are we moisturizing something that's dead, right? But you see these, or even a cuticle softener or a conditioner. Why are they called that? It's just a marketing tool, right? Because ain't nobody about to call it a proximal nail fold softener. That's a mouthful, and nobody knows what a proximal nail fold is but you. Okay, so cuticle removers are professional products, all right? And when applied to the nail plate, those are going to help remove that cuticle a lot faster. But we can also remove it with gentle pushing and just regular water, okay? So everybody understand what the cuticle is. It's dead, right? Now, the eponychium. The eponychium, remember I said earlier, like, why does it keep coming back? Why does the cuticle keep coming back? Well, that's because the eponychium is living tissue that is attached to the cuticle. Okay? So I like to give you guys this example. Think about like a vampire, right? A vampire, what happens when the vampire comes out in the light as if they're a real thing, y'all? What happens? What happens on the movies, y'all? They do what? They just they turn to dust. They die. They boof, disappear, die, turn to a pile of dust, right? So think about the cuticle. It used to be the eponychium. It's like a butterfly. It used to be a caterpillar, turned into a butterfly, right? Went to a cocoon, turned to a butterfly. Well, in this case, the eponychium started in the matrix area. You see where it says stem cells of the eponychium layer? That eponychium layer starts in the matrix. Those stem cells start in the matrix, and then they grow up the nail plate. And as they grow, they're protected by what? What keeps them alive? What are they protected by? Remember what we just talked about? What is protecting the matrix? The proximal nail fold laying right on top of it, protecting it. So those eponychium stem cells are protected by the proximal nail fold. So if we lift that proximal nail fold up, which you guys have seen it so many times on the internet, right? People just scraping up under there, cutting all that skin around. So if we disrupt that, then now we're exposing living tissue, okay? So as that eponychium starts to grow up the nail, what happens when it gets past the proximal nail fold and it's exposed to the light, just like a vampire? What happens? What happens to the vampire, y'all? Turn to dust and die. So basically, the eponychium the cuticle used to be the eponychium. But it grew out and it was exposed to the light, exposed to washing your hands, exposed to just living and everything. And it died right there on the nail plate. And as that eponychium is growing, it's pushing it. It's pushing. That's why your cuticle keeps coming back. Because there's something that's alive and growing underneath that proximal nail fold that gets pushed out until it's exposed to the world. And then it dies on the nail plate and is now the cuticle. Does that make sense? So the eponychium is often confused as the cuticle, okay? Because when you, like I said, when you push that cuticle all the way back, that proximal nail fold all the way back, and you're picking that skin, that fold up, which happens when you're doing these Russian manicures, when you're picking those folds up, you're now digging down into that eponychium area, and you can cause damage, okay? Now, I'm going to ask yourself a few questions. How do you know the difference between the eponychium and the cuticle? Okay? How do you know the difference? Well, first of all, ask yourself these simple questions. Is the tissue adhering directly to the nail plate but easily removed with gentle scraping? If the answer is yes, then what is it? It's the cuticle. Okay? Is that tissue thin and colorless, and bless you, but visible under closest inspection? If the answer is yes, what is it? Cuticle or eponychium? Cuticle. It's cuticle. Is that tissue non-living and not directly attached to living skin? The answer is yes, then what is it? Cuticle. Okay. Now, if you answered no, then it's probably eponychium. So ask yourself these questions as well. Does that tissue cover the nail plate, the nail matrix, the nail matrix? If you down in the matrix area, what do you think it is? Is it eponychium or cuticle? Definitely eponychium. And this is the most important question. And this is one that no nail tech can answer, but they do it all the time. Okay? If I cut deep enough into this tissue, will it bleed? And I don't care if you don't bleed. The question was, if you cut deep enough, will I bleed? So that means that area that everyone's trimming and cutting and all that, they don't know how far back to go. There's no rule that says, oh, it's 1 millimeter, 0.5 millimeter, all of this, blah, blah, blah. So that hard tissue that when you push back the cuticle, because we all got it, when you push this back, right, I'm push. Sometimes you end up with this, like, you push back the cuticle, right, but it's still attached, right? It's that dry, crusty ring. So what do you guys want to do all the time? You want to take a little clippers and clip it off. But my question to you was, if I cut deep enough, could I bleed? If you even have to ask yourself that question, that means you shouldn't be trimming it at all. So what do we do because I pride myself with having pretty decent cuticle areas. Like when you guys have all had clients where you push it back and it looks like it's about 3 inches that you could cut off and it still wouldn't bleed, right? The reason for that is because that client is not moisturizing their proximal nail folds with cuticle softeners, right? That's what they call it, right? But what is a softener that we can use to moisturize our skin around our nails? Cuticle oil. Hello. Now it's not for the cuticles, but again, that's a marketing tool. Okay. So the biggest thing I want you to take away from this is that nail technicians, we are allowed to gently push back the PNF, okay, and the cuticle. But we are prohibited. What does the word prohibited mean?
Not allowed.
Not, period. There's no, oh, well, I've been doing this a long time, or I know what I'm doing. But I'm not going to make them bleed. You don't know that. You just never, you trim mine, I'm going to bleed. I don't care how professional you are. I don't cut mine. But you are prohibited from cutting or trimming any living tissue, which includes the proximal nail fold. So if it doesn't easily brush off of the nail by just either moisturizing it with water, pushing it back with cuticle pushes, if it doesn't come off, then that means, guess what, ladies? You are not allowed to cut it. And if you do, you are taking a risk. Let me show you guys a video real quick. This right here make my stomach a little stiff. If you are queasy, don't watch, okay? If you are queasy, don't watch. Is she supposed to be cutting that? At all? Y'all see that? Y'all saw that, right? First of all, she probably caused that pus.
Yeah.
If that's her regular nail tech. But why are you Are you Dr. Pimple Popper? Like, why are you squeezing pus out of someone's finger? Ain't none of y'all in here, far as I know, medical professionals. And even as an EMT, I wasn't allowed to squeeze pus out of people's bodies. That's not way beyond my scope of practice. So why are you doing it? I don't care if you got gloves on. Can you imagine if that would have shot you up in the eye? Bless you. Gross, disgusting. Okay? So, yeah. Don't cut anything, because by cutting that skin, she now is introducing more risk to the client to end up with some type of infection. That's obviously what we call a paronychia. Okay? Everybody with me? I know I'm on a soapbox when it comes to Russian manicures, but I'm sick and tired of Russian manicurists or nail technicians doing Russian manicures and promoting them on the internet. It tells me a lot about you. A lot. Number one, that you ain't licensed. And if you are, what school did you go to? And number three, if you do that to me, and I catch even a little bit of an itch or an infection, I'm gonna own your nail salon, because I know better. And these clients need to learn it too, and start going to people who know what they're doing and have been trained properly. Because I'm a school owner. I love what I do, but I only want to teach people who are paying me. I'm sick and tired of having to teach people who are professionals that what they're doing is illegal or incorrect, and they're causing the clients to now question my trained licensed nail technicians. I get tired of that, and you will too. Okay, so moving right along. Let me get up off of that. All right, so we talked about the eponychium. Now let's talk about the hyponychium. What does the word hypo mean? You got hyper and hypo, right? Hypertension. If you got hypertension, that means you got what? High blood pressure. If you got hypotension, that means you got low blood pressure, right? So the word hyponychium, okay, means there's something below, right? So that hyponychium, if you look on the diagram, you can see it's that tiny little piece of skin that is underneath the free edge, but also attached to the tip of your nail, that skin, that nail bed right there. So it's that layer between the fingertip and the free edge. What is the purpose of it? Because you guys got to work on Shayla last week with the sculpted nail. You notice she got that high skin up underneath her finger. You push too far back with the form, it's going to hurt her, right? And some people don't have one at all, and that's a nail disorder that we'll get to in a minute. But that hyponychium, it has a purpose just like the cuticle, okay? The hyponychium is a protective barrier that prevents organisms and germs and all that stuff from invading the nail bed from the tip of the nail. So think about it like this. You ever had to lift the hood of your car, like you go to get your oil changed and they be like, boop. Well, I just go to Jiffy Lube. They do all of that. But you know what I'm talking about, that little button under there, and then your hood goes bloop, but it's not really all the way up. What do you have to do to get it up? Pull that, yeah, well, you got to pull it up, but isn't there like a little latch? And I'm talking to ladies, some of y'all ain't never lifted the hood of a car. I used to do my own oil changes. You lift that latch. You got to hit that latch for the hood to go up. And what is the hood's purpose? To protect the engine, right? I'm assuming that if we didn't have a hood, that water would get in there, it might do something bad or something like that, right? So it's the same thing. That latch is your hyponychium. And without that latch, our nail bed, our nail plate will lift, and now things can get under our nail and expose us to microorganisms that can hurt our nails, okay? So we want to treat this area very gently. Yeah, sometimes it's dry and crusty, right? But again, what do we do to treat dry and crusty? Cuticle oils, moisturizers. If you guys are doing nails right now, and some of you are, if you are not retailing some type of cuticle oil to your clients, that's why you working so hard, honey. That's why you work trying so hard to make those nails look pretty when they leave for Instagram and TikTok. Let your client do the work. Send them home with some cuticle oil. Tell them to oil up those cuticles twice a day before they go to bed and when they wake up in the morning. And I guarantee you when they come back in 2 weeks, they're going to have a whole different set of hands for you. Okay, but we want to treat that area very gently. Please do not take drill bits and file the skin off. Okay, please do not do that. That is not going to work. All right, that is again beyond your scope of practice. We are not estheticians. We are nail techs. We should not be filing off skin. All right, off of the client's hands. Now, there are some ligaments in your fingertip that literally holds that nail plate down to your bone. All right. So if you've ever seen a nail that has been snatched out of a finger, okay, and this happens a lot with the entire nail gets snatched out, especially if you're using MMA. Okay. Whole entire nail that you might, if it's a really bad traumatic injury, you might actually see that ligament. And that, I promise you, you're probably not going to have a nail after that, okay? But that is attached directly to the underlying bone located at the base of the matrix. If you look at the picture here, you see that the matrix damn near touches the bone, okay? And that's how it's held in by those specialized ligaments, okay? Now, let's talk about things that affect the growth of your nail. If you look at this picture, I guarantee you some of y'all, either you've seen or you have nails that look like this, okay? And how do they end up shaped like this? What did I tell you guys? Your client's matrix. Your client's matrix is the reason why their nail is shaped like this. Don't know exactly the science behind it, but a flat nail versus a concave nail versus a convex nail. Anybody see their nail shape up there if you got a weird looking nail? I know my sister has them concave nails. I hate them. They go whoop and fan out. Almost impossible. Every time she wears tips, her nails always go up like this. And it's not very attractive. So with that being said, this is why you guys need to learn how to sculpt and versus tips, because sometimes you got clients whose nails just aren't going to take a tip. They're just not going to take it. Okay? So what about those at the bottom, those really teeny weeny little almost non-existent nails, right? All the yep. And remember, our foundation is very important. If you don't have very much of a foundation, those types of clients should not be wearing super long nails. You are doing your client a disservice. I'm sorry, they just shouldn't. Okay? So, we already discussed this briefly, but now you can see these different shapes. Again, these are directly related to the matrix. All right? Now we're going to get into these disorders and diseases and things of that nature. And there's a lot of onycho, and lots of words that you probably are not going to be able to say or spell. Okay? I can't spell none of them. But I know what they are just by looking at them because of the way I have either taught myself or other students have come up with different ways for us to remember these things. Now, this is a nail plate malformation, okay? This is direct. Remember what I said about my nail being malformed because of the matrix? Well, in this case, this client has what's known as nail grooves, okay? Nail grooves. First of all, let me backtrack. How long does it take for a nail to grow from the rooter to the tutor, from the bottom to the tip, from the matrix to the free edge? How long? A fingernail.
6 to 12 weeks.
What'd you say?
6 to 12
Weeks? Ooh, weeks. Okay, think about, because I want you to think about what you just said. Think about like when you're getting a fill-in, right? Every 2 weeks, it grows like this much, a millimeter. So 6 weeks, that ain't going to be much, right? You might be past the lanula. So how about months, okay? So 4 to 6 months for complete replacement of a fingernail. What about a toenail, y'all? Because we don't talk about the toes very often.
Is it 8 to 12?
9 to 12 months. It can, depending on the client's health and how bad they broke it, 9 to 12 months. And if you're older, more elderly, it could take 2 years for a toenail to grow back. Like, we're talking big toes here, not little bitty ones, okay? Now, in this case, because I want you guys to know the difference between, this is called nail grooves, okay? This is an injury to the matrix. Remember, when you see these, because you are going to see anybody gotten there, remove the ridges. If you do that, what's going to happen? It's going to damage it how, Arumi? Going to finish. So don't go around telling your clients they got a disease because they got a black band down the middle of their nail. Okay? Please don't do that. All right? Ask your client, is this new? Is this something that just happened? If some people will tell you, I've had it my whole life. I've had this my entire life. All right? And it could be, like I said, it's common in African Americans. Anybody have a black band down the middle of their nail like that, or a spot where you ever seen it before? I've seen it before several times. Okay, so again, it could also be an indication of cancer in people that are of lighter skin. Okay, now nail psoriasis. What is psoriasis? Anybody got it? Yeah, psoriasis. What do you have with psoriasis? Rash, dry skin. You get a rash. Your skin is dry and flaky. Psoriasis also is dandruff. Is the psoriasis, right? What do we have when we have dandruff? Dry, flaky scalp, right? Well, you can also get psoriasis in your nails, okay? And it looks exactly like the skin almost. It's just on the nail plate. It's going to show up as surface pitting, roughness. It could also, you could have lifting from the nail plate. But a lot of times it's just going to look like your nails have already been buffed, like remove the shine. Okay? This is not contagious. Psoriasis is not contagious. Skin psoriasis, dandruff, all that stuff. None of that is contagious. But with that being said, hopefully the client, they usually know that they have this going on. Yeah. Right? They're not going to just show up and like, I don't know why my fingernails look like that. They usually know why. And they usually have another associated disorder as well. Now, this next one, nail pterygium, and that's how it's pronounced. The P is silent. Okay, in the English language, I swear. Nail pterygium is how you pronounce that. What is that? That is, first of all, very ugly. Okay, I would die if my finger looked like that. I'm very lucky that my finger don't look like that.
Yeah.
Okay, I would probably not have one half of that nail, the right hand side, if my injury would have been different. So it's abnormal stretching of the eponychium or the hyponychium. Okay, and this around the nail plate, and it's usually from an injury. Or it could even be from an allergic skin reaction, okay? And you can treat this with creams and oils, but there's really not anything you can do to fix that. It's usually going to be like that forever. And I would highly recommend not putting anything on top of that nail, meaning no extension, no acrylic, none of that. You can polish it maybe. You can do a little nail art, make it like one side pink, one side purple, you know. You can. That's about all. All right, but don't do anything to that client as far as extensions are concerned, okay? It's not going to help. It's going to make it worse. Now, here we go. Onychophagy. That's how that's pronounced. Onychophagy. Now, it's so funny. The names we got yesterday were hilarious. What did Tamara say? She would have said something. Now, again, you may not be able to spell it, but you need to be able to recognize it on your state board. So right smack dab in the middle of that word, what do you see? What word? Chop. Because the word or the condition onychophagy is quite literally bitten nails. Somebody who bites their nails. That's the medical term. So, and they call it is a medical condition usually because if you do it a lot, you don't have any. It's usually some type of nervous reaction, or you do it because it's just a very bad habit. Okay. But proper manicures and manicure, often getting manicures can help with this issue. I had a client. If you can get one of your clients to stop biting their nails and growing their nail, honey, they'll be your client forever. Okay. So onychophagy, the word chop is right smack dab in the middle, and that means to bite your nails. The next one. This one is pronounced onychorexis. Okay, if you notice, this nail looks very dry and brittle. Okay, going to appear as surface roughness on the nail plate. This could be hereditary, but what I want you to remember for state board purposes, because you can see inside this word, there is, if you break it down, is chore, the word chore, C-H-O-R without the E. Okay, when you see this on your state board, you're going to see harsh cleaning agents can cause this, meaning this client quite possibly is one of those people that washes their dishes with bleach water. Y'all all know somebody that does that, or even bathes in bleach water. Or they work in an environment where their hands are always in some type of chemical, okay? And their fingernails will suffer because of it. So onychorexis, okay, is going to be from harsh cleaning agents. Just for your, like I said, for your state board purposes. And it's going to show up as a very dry, brittle nail, okay? The next one, pincer nail or trumpet nail. What is that? You see this a lot on elderly people, okay? It happens over time. But it's literally, the nail looks like a trumpet, or the front of a trumpet, or it's pinched to look very narrow, and this can be very painful. Okay, it's a dramatic curvature of the free edge. That nail can sometimes curl all the way around and be deformed on either one side wall or both. Okay, extreme cases can cause a lot of pain to your client. So again, these people are probably going to be going to an advanced nail technician or a podiatrist to get their nails cut. Okay, and trimmed. And in those cases, I mean, I wouldn't mind getting $100 just to trim someone's toenails because they're usually not getting anything else. Okay, so y'all think about that A&T course. And how do you remember that? They're both the same. They both go together. Okay, pincer or trumpet. You call it one or the other. And the way I like to remember that is, I don't know if y'all remember the first time Trump ran, he had a vice president named Mike Pence. Pence and Trump, they go together. Okay, they don't like each other no more though. All right. The next one, plicatured nail. That's how you pronounce it. That's literally a folded nail. This is like an ingrown toenail on the fingers. It can happen on the toes too, okay? But usually when you see it on the finger, it's called a plicatured nail. This is a highly curved nail plate. And how do our nails grow? Remember how they grow, where they grow from? The matrix. All right, so this client's matrix caused their nail to grow this way, okay? And where it bleeds and it cuts down into the side of the nail, the sidewall. So if their nail is bleeding like that, we're not working on it, can't work on it. They need to go home and cut their nail down and heal or something. They got to keep their nails short all the time, all right? Now, the next one, not to be confused with the nail grooves.
Wait, I have a question.
Yes, what's your question?
What's the difference between the pincer nail and the?
Trumpet nail? They're both, it's just two.
Oh no, not the
Oh.
trumpet nail, the one that we just.
The plicatured nail?
Yeah.
Well, in the plicatured nail just means it's folded to the point where it's cutting into it's folded. It grows that way naturally. That pincer and trumpet nail, it's a disorder that you get over time. That plicatured nail, she probably always had that problem because that's just the way her nail grows. It comes from the matrix. The pincer nail and the trumpet nail, I'm not really sure why people eventually get that as they age. Because I promise you their nails didn't look like that when they were in their 20s. Right?
I remember the plicature nails more so like an ingrown.
Yeah.
Kinda
It's
sort
more like it could be inherited or come from be hereditary, but it causes ingrown nails. Pincer nail, you could have a pincer nail and it not be ingrown at all, not be digging down and making you bleed at all. Okay, it just grows into a curve. And I've seen some pictures online of, if you Google it, you'll see some that people they can grow their nails out super long and there's no bleeding, no ingrown at all. It just curves at the free edge. Remember, this is at the free edge with the pincer nail. It's really, really highly curved. Okay. Now, the ridged nail, did that answer your question?
Yeah.
Okay. So the ridged nail is different from the nail grooves. This comes naturally with aging, just normal aging. Okay. It's not from an injury. You didn't cause this to happen. It just happens normally with age. All right. They look the same. Same thing. You don't want to file down the ridges at all. Now, the splinter hemorrhage, anybody ever seen this before? A splinter hemorrhage? It looks like you have a splinter in your nail, and you think you do. Sometimes you try to get it out. But it's not a splinter. Blood vessels that happen to pop and break in a straight line. Because remember, our nails grow outward, okay? Our nails grow outward. So from the matrix to the tip. So as they grow, they also have the blood vessels are lined up the same way. So if this happened to me before, because I was trying to take bite my nails off, my acrylics off, knowing damn well they was too thick to try to do that. And then you feel that little sharp pain. You're like, oh, feel that pain. Then you don't notice it until you get the nail off, and then you see those little broken capillaries in there, those blood vessels, and they're in a straight line, and it'll grow out. You'll notice it grows out over time, but it's a very small micro trauma to the nail bed. Okay, it's not a big deal. You can definitely put something over that on a client. Now, how do we reduce the chance of getting nail infections, y'all? Sanitizing, washing your implements, sanitizing and disinfecting them. This is how you're going to reduce the chance of your clients having these issues. Okay. Now when we get to the sanitation and disinfecting chapter, and we'll go over that briefly, because this is something that is very important. That a lot of nail techs, they think that you can just wash your implements with I don't know. I've seen so many different people are just using alcohol. They're not mixing their barbicide properly. All of this is very important.
I seen that yesterday on Instagram.
What'd you see?
This girl was like, not get ready with me, but like sanitize and disinfect my stuff.
Mm-hmm.
And I was like, that's not what that means.
What was she doing?
Cause she had like a big thing of water and she took the cap of the barbicide
Oh, the
and
cap.
poured it in.
The cap.
Yeah, just
Because
the
that's a
cap.
measuring device.
And I was
cap.
like, that is not
A cap full of barbicide with a splash of water. That's not how it
She had
works.
she filled the container with water and got the cap of
Didn't
barbicide
measure
and just
it.
poured.
No measuring,
I was
no
like, I
nothing.
know her stuff
It's
is
literally
very-
32 ounces to 1 ounce,
Yep.
I think, or 2 ounces. I can't remember. You got to do ounces.
Yeah.
You can't just splash. Oh, it looks blue. Mix it up like Kool-Aid. Put a little sugar in it. You can't do. That's not how it works. Okay, and that's how we end up with these clients. We think that our implements are clean, and they're actually gross and disgusting. Okay, so clean towels, clean implements. Now let's get to the last few slides here. These are a little bit harder to remember. Now, onycholiasis is the disorder that you will see the most as a nail technician. And most of this time, this comes from the nail tech. Okay? You are either putting nail tips on that are too tight. We talked about that, didn't we? Mm-hmm. It is the nails are too long for your client's lifestyle and they're bending their nails back and they're ending up detaching that hyponychium from the nail bed, all right? But what is onycholiasis? Onycholiasis is separation of the nail plate from the nail bed, and this is most often due to injuries. Obviously, this client has a separation. She had a bruise there, so she done mashed her finger, and when this grows out when that purple part, which is blood, grows out to the free edge, you'll be able to scrape that blood out from under there. First time she takes a bath and that free edge, it's grown to the free edge, that blood will be removed from under there and it will look white. Okay, and it will be completely separated. And now she'll be susceptible to all kinds of nastiness going up under there, right? So how does this happen? Again, injury, it could happen from an allergic reaction. But once the cause is removed, the nail usually heals back down and you have a normal nail. How are you going to remember onycholiasis? She's not lying. That's exactly how we remember it. So the way I remember this one is if you break the word down, you see the word lie and sis. Okay. Now, I don't know about y'all, but if my man lies to me, we're going to separate, baby. He got to sleep on the couch. He can't sleep in the bed with me. So we have separated. He lied to you, sis. So now you got to separate him from your bed. Okay? You got that? Onycholiasis, separation of the nail plate from the nail bed. Make sense? That's how you're going to remember that. And you will never forget it, I promise you. You remember these little things. I can't forget it. I'll probably be old person in the nursing home going, he lied to you, sis. Y'all know what onycholiasis is? I can only imagine what I'm going to be like when I get old after doing this for so many years. All right, the next one. It's the longest, and it's the most simplest one. Onychocryptosis. Onychocryptosis. First of all, bless you. When you see oni in front of any of these, you know it's directly related to the nail. It's a disorder of the nail, okay? Onychocryptosis is literally an ingrown toenail, okay? And in that word, you see crypt and toe. Crypto, I got a crippled toe, cryptosis, onychocryptosis, okay? Don't ever try to learn how to spell it. Just know when you see it and when you hear it what it is, okay? Got that one? Those two were easy, right? Onychocryptosis and onycholiasis. All right? Now these next ones, getting a little more detailed. Onychomedisis. Onychomedisis. Now this one is very similar to onycholiasis, but it's a little bit different, okay? Onychomedisis is separation and falling off of the nail plate, okay? Different than onycholiasis, because onycholiasis is just separation. In this case, the nail is going to fall off. Okay. Now, how does this happen? It can be from an infection. It can be an injury to the matrix or some type of illness. But a lot of times this happens with chemotherapy. Okay. People lose their fingernails sometimes. Now, how are you going to remember this? Well, everybody know who Tyler Perry is? Okay. Tyler Perry, who does he play? Medea. And Medea is supposed to be old, right? And what do old people do? They fall. Oh, she said sleep. Yep, I sleep a lot. Onychomedesis, old people, they fall a lot. Okay. And so in that word, you see this is how I remember it. Medea. Okay. Onychomedesis. That's separation and falling off of the nail plate. Totally different from onycholiasis. Okay. And someone just said in the live, my dear, y'all do know what Medea, why they call her Medea, because that ain't her real name. What's her real name? Mabel. Mabel, right? You know why they call her Medea? Why? Huh?
Like the OG, like the grandma.
What you're saying is the real country way of saying my dear. And you just kind of, it's southern, real southern. Medea. Okay. So they just call her Medea. Okay, so with that being said, everybody understand that one, the difference between the two, because these pictures aren't the best. Now the next one is onychomycosis. Anybody remember that one? What it is? Let them. I got so many seniors in here. I want to know. Onychomycosis. Not filing, but that you had it right with the F in the word. What?
Did she say? I think she said rings of fire.
Isn't it oh my sis?
Oh my sis, what? Oh my sis, you got a fungus. Onychomycosis is fungus of the nail, a fungal infection of the nail, okay? And then, like I said, this is a bad picture. You can't really see, but a fungus is contagious, okay? You guys, not to be confused with a greenie, right? Do we all know what a greenie is?
It's a fungus, but with moisture.
Right. It's a mold. It's still a mold is a fungus,
Yeah.
but so is mushrooms, and we eat them, right? I want to show you guys this that I got off of the internet. Well, I got it from Doug Shum. All right, so you see moldy bread, right? Why does your bread mold? Moisture, right? We leave it in the bag overnight. So artificial nails do not cause this. All right, it's not the cause of it. Okay, unsanitary practices and also moisture. Okay. Because think about what nails are. Acrylic, what are acrylates, y'all? They're plastic. All right, you put something in a plastic container and leave it there, what happens usually? It's going to mold, right? All right, got all that moisture in there. All right, so with that being said, I just wanted to show y'all that little thing. So fungus doesn't come from moisture. Fungus is spread. It starts from somewhere. It's unsanitary. Think your implements and things of that nature, okay? And it's usually going to be white. I don't know why they use this picture because you can't really see that. But fungus is going to be white, yellow. It can be scraped off of the nail plate easily, okay? And it can cause that nail to crumble and fall apart, all right? So, and it can spread all the way back to the matrix. And then when you get to the matrix with a fungus, that's what leads you to the next one, which is onychosis or onychia, okay? Inflammation of the matrix is what that is. Inflammation of the matrix or an infection of the matrix, okay? Now, how do we remember that? I told y'all, well, onychomycosis, oh my sis, you got a fungus, okay? Again, you need to be able to recognize these on paper or on that screen at State Board. Onychosis or onychia, they're both the same thing. There's different words, okay? It means inflammation of the matrix. So everybody know who Nicki Minaj is, right? What's her real name? And y'all Nicki fans? Onika. Onika. So you see Onychia. You hear Nicki Minaj, Onika, okay? What is she known for? That big old butt, okay? So I'm going to just say her butt is so big, it could be considered inflamed, okay? So Onika, inflammation, okay, of the matrix. Y'all got that? That'll help you remember that. Onychosis or onychia, okay? Onychia is inflammation of the matrix. Someone asked, moisture is not contagious. Moisture is caused by you, the nail tech, or the client, okay? Hopefully you take a bath every day or wash your hands a lot. And if you have a product on that is not completely on the nail properly, you're going to have greenies, okay? Now, we talked about paronychia. That's just going to be the same as an infected finger, but the name technically is called a paronychia. Think about the perimeter of the nail, the skin around the nail, which is known as the paroxysmal nail fold, right? In getting infected. So that's what paronychia, onychia, an infection, inflammation. If you put these words together, they make sense. That's what medical terminology is all about, breaking it down. So inflammation of the tissues around the nail plate is a paronychia. Now, this is our last slides here, y'all. So this next one looks, it's the hardest one to spell. I cannot spell it, but I can say it. The Pseudomonas, the P is silent. Pseudomonas aeruginosa. Anybody a Harry Potter fan in here? Yeah, you said you are? Well, did you raise your hand or you was holding on? Okay, I'm not a Harry Potter fan, but I was told by one of my students, she said, that looks like a Harry Potter spell. It sounds like a spell. Pseudomonas aeruginosa. Okay, now it looks like somebody put a bad spell on you, okay? But apparently there's a sorcerer in the Harry Potter books or movies called Sirius Black. Okay, in this particular disorder, this is a rapidly growing contagious bacteria, very contagious. First of all, I hope none of y'all are going to try to do nothing with a nail like that. You're going to definitely refuse service, right? But in its early stages, it starts out yellow, green, then it turns from brown, and it eventually turns black, okay? So I just told you it sounds and looks like a Harry Potter spell that Sirius Black, the sorcerer, okay, made your toenail go from green to yellow to black, okay? Does that help a little bit? You'll just remember that it ultimately is going to turn that fingernail black with fungus, okay? And it's awful. It looks awful, and hopefully you're not working on that. Last two. Pyogenic granuloma. Pyogenic granuloma. This is a severe inflammation of the nail, and this can happen on more places than just your nail. It can happen on your eye. It can happen all over the place. But this is a lump of red tissue that grows up from the nail plate, okay? So in that word, I know this is probably going to make y'all not want to eat granola bars anymore, but I see the word granola when I just look at it real quick. And so that looks like a little chocolate chip or maybe a cranberry or something like that in a granola bar, okay? Pyogenic granuloma. It's a growth. Comes through the nail plate. And then the very last one, this is the most common disorder you will see in the nail salon. And if you're not very knowledgeable of these disorders, you will just think that the client has dry skin. But what is tinea pedis? Athlete's foot. Okay, an athlete's foot is highly contagious. If your client has athlete's foot, the only way to get rid of it, I don't care what you see at the pharmacy, those creams and athlete's foot creams, all they do is treat the symptoms. They don't get rid of it. Okay, and a client who has athlete's foot, 9 times out of 10 don't have it on just one foot. Okay, you can contract athlete's foot by touching someone's foot that has athlete's foot. On your hands, on your implements, all of that. And again, your client is going to think they just have dry skin because it presents as a flaky, dry skin, but you will know that it's athlete's foot because they usually have pain and itching, redness, red patches. You can smell it, okay? Usually it has a very distinct smell, okay? So they know they got athlete's foot. They know it, okay? And they still gonna come to you and ask for you to scrape that skin off the bottom of their nasty foot, okay? So we do not work on athlete's foot, period. Got it? So that is the end of the lecture, y'all. Just remember your scope of practice, okay? Follow the rules that are set by the state board. And this is no matter what state you're in. All state boards are different. But I can tell you this. I don't know of one that allows you to do a Russian manicure. And I don't know of one that allows you to work on unhealthy, intact, or not nails that are not intact or bleeding and all of that stuff, okay? And so know the difference between what is a beauty service and what is a medical service, okay? Everybody got that? We good? Y'all remember this stuff? I'm going to give y'all about 5 minutes to go over your notes before I give you this test. Okay? The test is a diagram of what we just talked about with the parts of the nail, and also a, not multiple choice, but a matching test. I'm not just giving this to the freshmen. I want all of you guys to take this test.